You know, for millions of people all across Africa, getting a medical diagnosis is really just the first step in a long and incredibly difficult journey. It's a journey where you often have to cross borders, not for a vacation, but literally for a chance to live. But this journey, it comes with a massive, often invisible obstacle.
Yeah, this quote, it just cuts right to the heart of it all, doesn't it? Imagine that for a second. You know what's wrong, you have the diagnosis, but the one person on earth who can actually fix it is in a different country. For so many, that's the reality. And that's where a whole new, much more complicated journey begins. A race against time, against red tape, and against the odds.
So you might think the biggest hurdle is the flight, right? Or the distance, but it's not. The biggest challenge is the maze of bureaucracy, the endless paperwork, and the scattered pieces of information that patients have to somehow pull together just to get to that surgeon. It's a whole journey before the real journey even starts.
Okay, to really get this, let me introduce you to someone. This is Mary Zulu. She's a teacher, a real pillar in her community. And after a series of scans in Lusaka, she got a diagnosis that would change everything. The problem? The specialist she desperately needs, the one person who can give her a real fighting chance, well, they're not in Zambia.
And this is the gauntlet she has to run. It starts local and then it just escalates, one agonizing step at a time, each one packed with delays and uncertainty. From her local district hospital to a provincial one, then to the national specialist hospital, and finally, maybe, getting approval for an international evacuation. Every single step is a potential dead end. Another week, another month of just waiting.
And you want to know what's just infuriating about this whole process? It's how inefficient it is. At every single turn, vital information gets lost. Scans have to be redone. Tests get repeated. And physical records, they can just vanish. And while all this is going on, precious weeks are ticking by. And diseases, well, they don't wait for paperwork. Look, Mary's story is heartbreaking, but it's not unique, not by a long shot. What she's going through is really a snapshot of a much bigger systemic crisis that affects people all across the continent every single day. It's a crisis of access, a crisis of information, and ultimately a crisis of hope. And this crisis has so many faces. I mean, take Daniel in Nairobi. He's a mechanic trying to piece together his entire cardiac history from a bunch of scattered paper files and random USB drives. Or think about Aisha in Lagos, an entrepreneur who needs incredibly complex, coordinated cancer care before she can even dream of traveling for treatment. It's the same fundamental challenge, just a different city, with a different life on the line.
And if you want to talk numbers, the scale of this is, well, it's just staggering. Nigeria alone is estimated to spend over $1 billion a year sending its citizens abroad for medical care. This isn't just a healthcare problem, it's a huge economic drain. That's $1 billion that could be going into building a stronger healthcare system right there at home.
And this chart right here, this really shows you the heart of the problem. According to the World Health Organization, think about this. Africa shoulders about 25% of the world's entire disease burden, but has access to only 3% of the world's health workforce. That gap, that massive chasm between need and resource, that's where all these problems take root.
So just how big is this problem on a global scale? Well, the Lancet estimates that 5 billion people worldwide don't have access to safe surgery. Sub-Saharan Africa is one of the hardest hit regions, which just goes to show how critical this issue of access is and just how many lives are hanging in the balance.
So it all boils down to this one simple, tragic fact. People have figured out how to travel for care. They've crossed borders, they've navigated visa nightmares, they've raised the money. But their most important asset, all of their medical information, it gets left behind, lost in a broken system. And that right there is the real tragedy.
But what if we could fix that information gap? What if we could create a kind of digital health passport that makes sure a patient's data arrives before they do, complete, secure, and ready for the doctors who can actually save their life?
And that's where a new idea is coming into play. A company called AfriPharm Health is tackling this problem head-on. They're not trying to build more hospitals. They're trying to build a smarter, more connected information system.
At the very core of their solution is something called the Health Vault. Think of it like a secure digital locker for your entire medical history. A vault that only you and the doctors you choose have the key to. It's designed to be completely portable, so it crosses borders just as easily as you do, but with absolutely none of the hassle. So what's inside this vault? Well, it's basically everything a doctor needs to know. All your diagnostic reports, your lab results, crucial imaging like MRIs and CT scans, notes from all your doctors, and even your complete prescription history. No more lost photocopies, no more forgotten USB drives. It's your entire medical story all in one place, ready to be shared with the people who can help you write the next chapter. Okay, so this all sounds great in theory, but how does it actually change things for people like Mary and Daniel? Well, it's a total shift from chaos to clarity, from a fragmented past to a seamless future.
Honestly, the difference is like night and day. Before, you've got lost files, agonizing delays, and endless repeated tests, each one just a painful reminder of the time you're losing. But after, you have structured, portable data that specialists can access instantly. This allows for planning and triage before you even leave home.
So let's go back to Mary for a second. With the Health Vault, her complete file, every scan, every doctor's note, is securely sent to the neurosurgical team in South Africa. They can review her case, understand all its complexities, and actually prepare for her surgery while she's still in Lusaka. That means the second she walks through the door, there's no wasted time, no repeated tests, just a clear plan ready to go.
This is something called diagnostic continuity, and it is a total game changer. The specialist team can see the whole story. They can analyze how her tumor has grown over time. They can triage her case properly. And most importantly, for the first time, the system actually starts to move faster than the disease itself. And that is a life-changing and life-saving shift.
Okay, so that's Mary. Now what about Daniel, the mechanic with the heart condition? Well, for him, the Health Vault has another really powerful feature that can make all the difference: smart prescriptions. This helps manage his medication perfectly in the weeks leading up to his trip, making sure he's in the best possible shape for surgery.
And this system is incredibly smart. It automatically analyzes for any harmful drug interactions, protecting him from dangerous side effects. It helps him stay on schedule with his doses, making the medicine as effective as possible. And it makes sure nothing he's taking will interfere with his surgery. So when he finally arrives, his new doctors have a perfect medication history, which means a much safer, more predictable outcome for him.
You know, all of this brings us to a really fundamental point. For decades, it feels like we've been focusing on the wrong problem. We thought the barrier was distance, but the real barrier, it's always been information.
See, here's the bottom line. The biggest hurdle in medical tourism has never actually been the physical journey. It's always been the journey of their information. When you fix that, when you make sure that a patient's story arrives whole and complete before they do, you transform their entire experience. You turn a journey of fear and uncertainty into a journey of hope and healing.
Because really, after all that, after traveling thousands of miles, after weeks of waiting and anxiety, the absolute last thing any patient should ever have to hear are those 5 deflating words. It's a sentence that represents a system that has failed them. And it's the sentence we now have the technology and I think the moral obligation to erase forever.